Now, English for nurses has been gaining importance in the recent decade or so. So now let's go to see why is it important. Why are English skills important? Do nurses really need English skills and work on their English just like they do on communication? One important reason is globalization. Now the market is globalized and so is healthcare. So with the advent of globalization, there are always healthcare staff and medical staff moving on to different parts of the world in search of better prospects. And on the other hand, there's also medical tourism is picking up. There are a lot of patients from a whole host of other countries coming to India for medical care because of the competence that we offer. And so that's one main reason. And also English has become the universal language of medical communication. So most of the journals, for the most part, most of the journals, literature, the drug information, the documentation that's to be done is all in English. So that is another main reason. It has become the common medical literature language. And now for a patient who knows only English or English better than the other vernacular languages, that helps to promote patient-nurse rapport. Because when there's a good rapport between the patient and the nurse, the patient tends to report a lot of things to the nurse, which then can be taken care of the nurse, or else it goes to the physician. So that's one important reason. And then there's a need for a common professional language because of the globalization again. Now, what needs to be learned? As far as English skills are concerned, most of the nurses are very good at their technical skills, vocational skills, patient care. But when it comes to English, just like Dr. Rita Lakhani beautifully mentioned about communication, sometimes there's there is a gap which needs to be filled in. Now, where does this step in? Establishing a relationship with the patient. Minor things such as asking the name, age, and other basic details, and also introducing yourself to the patient and the patient's family. Next is knowing the right medical terminology. So it's easier to communicate with fellow nurses, doctors, and healthcare team because it's always a teamwork. Another important point is to document and record incidents or patient histories or important notes for the next round of doctors, etc. Some of the common situations that we might encounter are the patient may report to the nurse that last night I had fever and I was shaking and shivering. That might be, that should be recorded as a rigor. The patient might say, I had swelling on the right foot last night. It developed and it hurt, or I was finding it difficult to move. That would be edema. Itching would be pruritus, and severe exhaustion would be termed as malaise. These are of course common terms, but they need to be taken care of and skills developed so as to enable the nurses to be on par. And sometimes the patient may say, I had ache, my head, I had ache at the back of my head. That would be an occipital headache. Because these terms such as collarbones or back of the head cannot be written on the patient records, because that goes to the physicians, it goes to the management, and in some cases it goes to the insurance personnel also. So all of those have to be in proper medical terminology, and with the advent of medical billing and coding, etc., all these are going to be interpreted input format to the coding companies, billing companies, etc., for the billing to be processed back to the organization and to the patient. How is it useful? When recording a patient's history, the minor details such as a pain, a simple thing such as a pain, patient might say, I had pain in the middle of my chest. Such pain could be shooting pain, it could be pricking pain, it could be a stabbing pain, etc. Now, unless the nurse makes the effort to ask the patient what kind of pain it was, that could make that could lead to a whole different diagnosis in itself. The reason could be cardiac, it could be pulmonary, or it could be a simple GERD. So things like this are important. Then explaining diagnosis to patient and family members. They may not need the medical jargon per se, but skills are usually very important while explaining. And then comes the treatment plan. Patients and their families are usually anxious about what is in store for the patient, or how is the patient going to progress as far as the treatment plan is concerned. Is a CT going to be taken? Is an X-ray going to be repeated? Is the medication needs to be continued? So in such cases, English is always useful for communication. To always, as we just talked about, to transfer medication information. This in turn improves the quality of care. As we all know, nurses are the eyes and ears of doctors. So a physician or a doctor spends about 15 to 20 minutes on his rounds with the patient, but the nurse spends the whole of her shift with the patient, and if necessary more, when dealing with emergency care. So it is very important to bridge the gap between the physician, because they do not actually have the time to talk to patients or families a lot as compared to nurses. Now, what should be the focus on? Language. As far as language is concerned, developing vocabulary, learning proper grammar, formation of sentences, etc. Then pronunciation. Pronunciation becomes very common with when we need to avoid look-alike, sound-alike, false, which we will then talk about in patient safety. For example, epinephrine and ephedrine might sound similar, but they are two different compounds which may have very different implications when administered to a patient. Then communication, that is to develop a rapport with the patient and the patient's family, etc. Now the tone. The tone of voice is also very important, because patients often come in with a general insecurity and anxiety of what is going on with their health. And am I going to be okay? Am I going to be going home soon? So the tone of the patient, the tone of the nurse makes a huge difference. A caring, calming, and empathetic tone is very, very important. And then moving on to culture. Different patients, even in India, a patient from North India might have a different culture, or their beliefs may be different compared to a patient from the west of India. So it's always important to understand their culture. That is often reflected in the food they eat, how they address people, how they communicate with people, etc. For example, some patients, let's say we have Mrs. Joshi in the ward. Mrs. Joshi, Mrs. Kamala Joshi. Let's just take an example. So she might be preferred to be called Kamala. Be addressed as Kamala, rather. Addressed as Kamala. But there might be another patient who prefers to be addressed by their last name. In India, there's a very common culture where patients get attached to the nurses who are taking care of them, especially in long-term care. So words such as auntie or uncles are inquiring about the nurse's personal life, or where did she study, does she married, does she have children, where does the husband work, etc. These things might not be common in Western culture, where that would mean intruding a patient's personal space, invasion of privacy. But we tend to connect better with patients, with people generally. We have a culture of getting connecting better when we inquire about their personal life. So those culture and beliefs have to be taken into consideration. Now, what can be the applications of learning English skills? It definitely improves patient care, it gives a very good quality outcome, builds the reputation of the organization, and also helps the nurse move on in her skills and gain a promotion, etc. Gaining English skills broadens the opportunities, opens a host of worldwide opportunities for nurses who are interested in moving abroad to any country for that matter, which every country has their own set of qualifying examinations in language, especially English, which they have to take along with their technical skill assessment that is to be performed when they go in for an interview. Now, patient bias. So this is a very important aspect. Some patients tend to think that a nurse who communicates well or is better at English might be a good caregiver. That is just their impression. That's one of the biases a lot of patients have, especially the elite community. The elderly elite community who have retired from various senior positions tend to speak more in English. One is to imply to the nurse that they are good at communication or English language, and also expect the nurse to reciprocate the same way. Be a good listener always. So when you're familiar with the language, it is always easy to pick up accents, to listen to what the patient is trying to tell you, and thereby improve care and patient outcome in the long run.